Hey everyone, today we're at the Alzheimer's Memory Center off of Sardis Road in Charlotte. We're going to meet with Dr. Bilari and some of his staff and just learn about the treatment and the research that they're doing here. So stay tuned.
Why Alzheimer's? Why did you decide to focus?
Well, Alzheimer's disease is one of those fascinating diseases, the so-called great unlearning. In other words, we see it in folks who have had accomplished careers, they have accomplished lives, they have raised families, they have worked hard, and now it's time for them to retire and enjoy their retirement, and all that is robbed from them by this devastating disease, which I think is not only unfair, it's unfortunate, and not only for the patients, but also for their families who have to deal with all the adversities that comes with this disease.
That's a good point you raised there. So do you have any sort of tips for folks who are dealing with maybe a parent or a grandparent who's suffering from Alzheimer's? What can they do?
I think the very first thing that you need to do for your loved ones is try to get help. Talk with their doctors and get up a referral, have them their memory checked, have their primary care physician do some workup, and if they do find, if they do not, send them to specialized centers for further evaluation to determine exactly what they have. Just dementia itself doesn't necessarily mean Alzheimer's disease. There are other types of dementia that are not Alzheimer's disease, such as strokes can cause memory problems, traumatic brain injuries, alcoholism, infections, and a whole host of other conditions. So it's important if your loved one has memory problem, that needs to be evaluated and sorted out by a specialist to determine first if it is dementia, and second, if it is, what kind of dementia. So that way we can give the best treatments for that type of dementia.
Right, you don't want to treat the wrong thing.
That's correct.
So what age do folks typically begin to show signs of suffering from Alzheimer's?
Alzheimer's disease comes in two different peaks. There's a young onset Alzheimer's, folks in their 40s and 50s and 60s, and then the late onset Alzheimer's, which is usually 70, 75, 80, 85 years old. There is another phenomenon which we call age-related memory impairment. That means as folks get older, they become a little slower. They might forget here and there certain things, but that's not dementia.
That's normal.
They do not progress, that's correct. They do not progress to a full-blown Alzheimer's disease. And that's why we see 80, 90, 100-year-olds sharp as a tack, still doing their own thing, and they're happy-go-lucky, as opposed to someone with Alzheimer's who eventually, because of their disease, they become non-functional. They cannot communicate, they can't function, they cannot take care of themselves. These are the folks where families step in and help them out. But our center is unique in that we offer research. And in addition to the private practice and the care we provide, we are able to offer them research programs for those who are interested and qualified.
Okay. So how would one qualify?
Basically, we have ads running, and our center is well known in the city. A lot of primary care physicians send their patients to us. People look up at the ads, and they come in. We evaluate them, and if they're suitable candidates for research, we offer. If they're not, then we take them on as a private patient, and we manage them.
Okay, so we met with Dr. Bilari at the Alzheimer's Memory Center here off of Sardis Road in Charlotte. Now, this disease is not curable today, but you can slow its progression. So if you know somebody, a loved one, or a friend who could benefit from some of the services they provide here, definitely check them out. It's Alzheimer's Memory Center off of Sardis Road in Charlotte. As always, thank you so much for watching. Have a great day.